Thank you for the opportunity to present this work entitled Characteristics of Geriatric Rehabilitation Inpatients with Nocturia. We have nothing to disclose. As you know, a high proportion of geriatric inpatients have bladder dysfunction, and an even higher proportion have bladder symptoms at night time. Our recent work found nocturia in 76% of aged care inpatients and urinary urgency in just over half. These urinary tract symptoms at night are associated with sleep disturbance and daytime fatigue. And as you will be aware, disrupted sleep attenuates attention, memory, and influences cognitive deficits. Will also compromise recovery, rehabilitation, and return to function. There are, of course, direct and indirect costs associated with patients having nocturnal bladder symptoms. And we know that these patients will stay in hospital longer and are at a higher risk for falls and falls injuries. Unfortunately, lower urinary tract symptoms at night are rarely described, and they're not routinely assessed or treated during the hospital admission. The aim of this study was to describe the characteristics of nocturia, the most common lower urinary tract symptom at night, in geriatric inpatients. This was a prospective longitudinal observational study using the multidisciplinary comprehensive geriatric assessment process. Patients were assessed within 48 hours of admission to a subacute ward and again at discharge. The exclusion criteria are there to see. With respect to the independent variables, you can see we had 4 domains: the comorbidities that we find in this age bracket, the mobility status measures that are routinely completed by allied health clinicians, the continence variables, and some cost data. The dependent variable was nocturia frequency, which was assessed using item 7 on the AUA symptom score. We had 641 participants who completed the nocturia item and were eligible to be included in the data analysis. The mean age of these people were 82.6 years and 60% of them were female. The median length of stay in the hospital subacute section was 21 days. This was a frail cohort who scored 6 out of 9 on the frailty scale. They were unwell, as evidenced by their comorbidity index. They were poorly mobile, as evidenced by their low scores on the short performance battery. And they were physically dependent, given that 83% of them were classified as less than 4 on the functional activity score. 2/3 of this cohort had impaired cognition, and a similar proportion reported falling in the last year. With respect to nocturia, 57% reported nocturia more than once each night. And on admission, the mean frequency was 2, and this had not changed by discharge. Men voided 2.2 times a night and women 1.8. And this was a significant but maybe not clinical difference. As you can see in the blue box, all the lower urinary tract symptoms that were measured on the geriatric assessment form were more prevalent in people who voided more frequently at night time. We were looking for items in all of the different domains that might help us understand the characteristics of the people with nocturia more than once a night. And the significant differences were seen for female sex, for falls history in the last year, for pre-admission deconditioning such that they couldn't climb stairs, for current fecal incontinence, quality of life impairment, anxiety, depression, and daytime sleepiness. Performing a model for the waking more than once per night to void allowed us to generate a significant model, but I don't believe that it explains the whole of the picture here. This may well be because we don't have the item of nocturnal polyuria in here, which we would expect to see in a very high proportion of patients with nocturia. However, the 4 independent predictors that were retained for voiding more than once a night are a comorbidity index score, disruption of sleep, urinary frequency during the day, and urinary incontinence. In this vulnerable older cohort of people with functional and cognitive decline, more than half experienced nocturia more than once a night whilst in hospital, and 45% of these people related it to daytime sleepiness, which will impact recovery and rehabilitation goals. Given that urinary incontinence and daytime frequency predict nocturia, suggests that the overactive bladder, the underactive bladder, and incomplete emptying should be evaluated during the inpatient stay. Of interest was the fact that the comorbid illness increased the risk of nocturia, but not necessarily via the pathway of frailty. This is where we may need to look further with people that have a component of nocturnal polyuria. Nocturia didn't change during hospitalisation, saying it was not adequately assessed or the etiology was not reversible. In conclusion, urinary incontinence and daytime frequency in the older patient with nocturia more than once should in fact trigger continence assessment and screening for reversible causes. Hospitalisation is an ideal window of time to initiate a bladder diary, collect ultrasound measures and initiate a workup. At this time, we can also include discussion of the nighttime bladder symptoms in family meetings, multidisciplinary meetings and ward rounds. Discharge planning should include community follow-up of nocturnal lower urinary tract symptoms with referral to primary or specialist care. Thank you.